current issue in the nursing field is the decreased mental health amongst nurses. I first noticed this when I actually became a healthcare worker. I verbally heard from other nurses, hey, this sucks, hey, we don't like working here because we're burnt out, we're going to go do travel nursing because it's better pay, better benefits, we're treated better. I experienced my own short staffing issues working in the hospital. I found myself spread way too thin. I was stressed out because of a high patient load for myself, and I became aware of my own decreasing mental health status. This issue affects nursing practice because when nurses are burnt out and they leave the field, this means more patients for nurses who are already there, and that causes more burnout amongst the nurses who are taking on higher patient loads because we're short-staffed. That ends up being a vicious cycle. Patients are not receiving the care that they're supposed to. We're not meeting all their needs. Nurses are there to finish a work list, give meds, assess the patient, turn the patient, repeat. So we're not meeting all of the needs of the patient, which leads to probably decreased patient outcomes. And then people are not wanting to receive care because they feel like they're being mistreated in the hospitals, which means that there's more disease in the community because they're not being treated and they're not being educated on prevention measures and how to treat their illnesses. And so it ends up just being a huge cycle that is hard to eradicate. An action that can be taken to help combat the mental health issues amongst nurses is cohesiveness between staff. Nurses should feel like they can go talk to their nurse managers about the way that they're feeling and have open communication without feeling like there's a stigma or judgment surrounding the way that they're feeling. Nurses need to also know when to ask for help. Asking for help before they spiral is beneficial for everybody who's involved, patients, other nurses, other hospital staff. One thing that I have learned from doing this issues research is that a lot of this happens within yourself as a person. You have to be able to recognize the signs that you yourself are struggling with mental issues, that you need help, knowing what your strengths and weaknesses are and how to better yourself in those situations. And once we understand ourselves and the traits in ourselves and the signs and symptoms of a mental health decrease, we can then see those things in other nurses and potentially help them as well. I believe that the people who run the hospitals do not know what is happening on the floors and the issues that nurses face every day. So it is our responsibility to advocate for other nurses and for our patients, as well as fight for ourselves, because we can't be effective nurses if we are spread too thin, we're stressed out, we're burnt out, our mental health is declining, therefore our physical state is declining. We cannot give patients proper care if we are not properly taking care of ourselves. So knowing when to ask for help and knowing the signs and symptoms that our own mental health is decreasing will be beneficial in the long run.